everybody. Welcome.
Happy New Year.
Yes, Happy New Year. We haven't seen you guys for a year, but welcome back.
That's true.
Right? Hey, tonight you're here because there's a really interesting subject. I know we have a lot of stuff to cover kind of before that, but our subject is going to be everything kind of exosomes, regenerative, things that build, things that, how do they stimulate tissue? So we're going to kind of get into that later on tonight.
I know. It's 2023. People get
Time to regenerate.
Oh, yeah. As we're getting older, we definitely need to regenerate a lot more.
Help me, Mr. Wizard.
But let's see. We're supposed to catch up. What have you been doing since last AI Live?
Whiz. You know, actually, December I left kind of a free month. I didn't travel a lot. I didn't.
Same.
Yeah, so I kind of. You were gone forever.
That was November.
You were gone forever. But yeah, December I left. We did trainings and classes, but I didn't travel a lot.
Neither
and then
did I.
Starting January, I'm back in the airplanes again, and between here and teaching every weekend.
I know. I think our weekends are booked out for the rest of the year.
The whole year. Yeah.
Yay. It's okay. We'll find some vacation time.
We have consistency. That's what we have. We have consistency.
Hi, guys. Hi, everybody. All right. So, do you have a good New Year's?
Mine was quiet.
Mine was quiet.
Yeah. I always like we're on the West Coast, so
it was raining like crazy here.
Yeah, it was. So and Brian was passing a kidney stone, so we just kind of stayed at home. Yeah, one of like 3, I think.
Oh.
So we just stayed home, and then I didn't even watch the New York ball drop.
You didn't even make it to New York.
And then I get up the next day, going, okay, I'll get up. I didn't stay up late. I'm gonna watch the parade. There was no parade on January 1st. The Rose Parade was on the 2nd. It was on Monday.
Oh,
it
was?
Yeah.
Oh, oops.
Yeah.
Oops.
Yeah. Whatever.
All right. So we have some announcements. We have a full packed year this year, guys. Full packed year. So we have lots of things. So if you guys have not started looking on the website or have not started looking on our Instagram, we're starting to block out our schedules for a lot of these things. So we're going to go over a couple of things that only take us through February and then some cool things that are happening in the rest of the year while we're still doing construction.
Right.
Which is the exciting things. We're expanding the Aesthetic Immersion. So we're going to have bigger, a bigger space to train more so we can have more students for our injectable stuff.
Yep, and more rooms where we can do injectable trainings with our beds, so and cameras and all that fun stuff. So feel free to take a picture of this, you guys, if you want to take a picture of this. And it's also on our website, but we have lots of stuff coming up.
I know. So let's go through
Lollipop.
This. January 17th, 6 p.m. webinar. I do a lot of cheeks. I've been doing this kind of technique. It's called the lollipop technique. So anybody that's trained with me has maybe gotten a taste of the lollipop technique. So I'm going to go over that because I really, really love the way my cheeks turn out. I get a more lifted look, more contoured look rather than widening. I think it has to do with the approach.
I do too.
I don't know. We'll talk about other techniques probably. Just gonna start with the basics and kind of roll through that. So if you guys are interested in a cool way of injecting cheeks and you want to start the new year off giving your patients better looking cheeks, join our webinar. You can register for that on our website, theaestheticimmersion.com. And then we do have, January 28th, a workshop. So we started this last year, right?
Yep.
I think there are a lot of students that have taken some classes and a lot of practitioners out there is like, can you guys train and do hands-on injectable training on advanced areas? So we decided this year to open up and kind of every so often do our workshops. So what does that entail?
And it's called an AI lab, and I call it Do It Your Way.
Do it your way.
Because if you're at least gone through our Foundations of Advanced Aesthetics course, then you can come to this. But more so, it's for the people who hopefully have some experience and want to level up. So we are here during this an entire day lab to help you level up and to help you do areas that you're not so comfortable doing, but we are right there holding your hand. So if you've done injectables for a while and you've never done under eyes, we are there to help you step up your game. So that AI lab is going to be for anybody. It could be a little bit newer. We'll help you with more basic areas, but actually people are a little bit more advanced. If you're doing jawlines, chins, temples, tear troughs, I've got an ultrasound machine here. We can pull that in. So anything you want to do that's going to up your game. So that's going to be really priceless and give people more time on tissue, which is what we need to be good.
Yep, exactly. I think that's really, really important. That's why we decided to create that program.
By popular demand.
Everyone wants more experience, more hands-on, more guidance. And so this is our way of providing that guidance for you guys. As always, with a lot of our injectable classes, we do record it, so you get a copy of it. I think that's one of the things that separates out our school is that you come to us. We literally have the cameras here that really, really hone in and focus on what you guys are doing so that when you leave, you can get a copy of it in a week or two or a couple weeks and review it, because that's kind of the most important part, reviewing what you did. Because I feel as though sometimes I'm injecting learning and then I literally forget what the hell
half of what someone said.
More than that. I think it's like 10% now.
So that's one thing. I think that's one thing our students have said that they love about our courses is that we have like 5 different 4K cameras around all of the beds that we're injecting, and all the students are mic'd up like we are here, and everything's recorded. So again, it's like they can go back. You guys can go back and rewatch and go, what did he say to me? What did she say to me? What depth am I at? What angle was my needle? How was I aspirating? So all of that stuff, you can kind of hear it again, and then it really kind of gets it. It kind of helps connect the dots. So it's pretty cool.
If you guys are attending the conference, we will be at AmSpa. It will be February 2nd through the 5th. I think you're talking, I'm talking. Drop by their booth. It's booth 533. It'll be at the Wynn in Las Vegas, February 2nd through the 5th. So we'll be there. So if you are going to attend AmSpa 2023, come say hi to us.
Come say hi. We're going to have times posted that we'll be in the booth together because we're both speaking at different times, but we will have times that we will be there. So you can come say hi and visit and meet us. We loved it. We love to extend our aesthetic family around the world, and it's it makes it fun for us to meet new friends. So come say hi to us.
Okay, and then our next AI Live, we've already decided we're going to be talking about semaglutide, Ozempic, Wegovy, Manjaro. These are kind of the whole, the industry, especially the aesthetic industry, has taken wind of it, and I know a lot of people are already starting to do that. So we're going to talk a little bit of semaglutide, our thoughts on it, and just go over a little session, little chit chat. AI Live is for us to kind of banter back and forth and kind of just talk about what we think, what trends are, and so we'll kind of go over semaglutide on that aspect of it. Then what do we have? February 9th, 16th, and 23rd. Benev is doing a free webinar series. I think the first week is going to be on Silphium X, which is their microneedling radio frequency. And Lori will be speaking at it with Dr. Rahi. Then there will be an exosome talk the following week. I don't remember who the docs are going to be talking on that. And then I'll be doing the last one in the series, which is on Miracle. So Dr. J.D. McCoy and Dr. Jin will be talking about the exosomes that we're talking about today. And then Miracle Threads on the week after, which I'm going to be talking with Panta about their threads that they have. So if you're interested, this is free webinars for you guys. It's going to be, I think, Thursdays on 5:30.
5:30.
Okay, so if you guys are interested, you can go to our link on the Aesthetic Immersion, and they should have it. Hopefully, that can link you to the registration for that.
Yay!
All right.
Free education.
Free education.
Go for it.
And then February 25th and 26th.
Yeehaw!
Let you talk about this, Lori.
We are taking Aesthetic Immersion on the road. So we have a lot of people who have asked for us. Usually our hands-on courses are all in California. Well, this year we are taking our Foundations of Advanced Aesthetics course and our AI lab, which is the advanced lab, on the road. And we are going to be at BCRN Aesthetics in Houston, Texas. That is with Bree Collins. She is a nationally known trainer and speaker. So we are going to be in Houston at her clinic on that weekend. And if you want to come, if you have a license in Texas, you come to Houston, sign up for it. It's going to be all day Saturday, all day Sunday is going to be the lab, and it's going to be really fun. So we will have our entire Foundations of Advanced Aesthetics course on that weekend. So we'll be there in Houston.
So we'll be training out in Houston.
Yeah.
I'm excited for that.
The horses, we'll wear our boots, cowboy hats.
So
It'll be fun.
Join us February 25th, 26th for that. What else? Besides that, I don't think it's been listed here, but we're already getting started and planning for June, our Hawaii. So if you guys don't know about it, we are actually going to be doing a cadaver
retreat. We're going to be doing a retreat, an entire aesthetic retreat.
We're going to be doing advanced injection demos. We're going to be doing business talks. We're going to be doing a cadaver lab. This is going to be set in Hawaii, Honolulu. So if you guys are interested, it's a limited, a limited retreat.
We want to keep this kind of a boutique-y retreat. We don't want it to get people to get too lost in it. So it is going to be limited. We want this to be really, really special. And the cadaver lab, which is all day Saturday, is going to be dissecting high-risk areas. So you can really get an idea of some of these higher risk areas and what the vasculature is under there and how many layers of tissue and muscle are there. So it's going to be really, really good. And then the next day we'll have a lot of our injectables and business.
If you guys want a nice write-off, this is a way to go on vacation and write it off.
Yeah, for sure.
But if you are very interested, email the team at learn@the Aesthetic Immersion or reach out through DMs on our Instagram, the Aesthetic Immersion, and let them know that you're interested, so they can put you on the interest list when they actually open it up, because there is going to be a very limited amount of registrants that will be allowed to attend for this, and we'll see how this goes. It's our first kind of venture into a retreat.
We've never really had a retreat before, but this is going to be, we're just going to Hawaii. We're going for it.
Yeah.
We chose
the best place for ourselves.
Right? We want to go where it's nice and sunny. Friday night's going to be like a reception where we can hang out and just be together and have some, luau drinks and hors d'oeuvres, whatever. So it'll be fun, and then we'll be learning a lot all day Saturday and Sunday.
That's going to be June 6th, 17th, 18th, something like that, a weekend.
I'll tell you, June. It's like the second weekend in June.
Is it the second weekend in June?
Hold on. Please hold. 23rd June. Sorry, guys. It is going to be the 17th and 18th of June.
16th, 17th, 18th.
Yeah, so 16th that night. So fly in by the morning of the 16th.
Yep. But if you want, reach out to the team early on, because I know there's already a bunch of students that are already trying to commit to that.
And we'll have a block of rooms at the hotel that'll be at least kind of a little bit cheaper for you guys.
Yep. All right. And then lastly, our mentorships. So we keep adding to our mentorships. These are the 3 levels that we do offer. If you're just getting started, Aesthetic Starter is great for you. Just nice videos to get you started. Our Aesthetic Insiders, majority of you guys, with lots of videos in our digital library, going from assessments to injection techniques, the different things that we do when we're assessing and how we inject differently. You'll get hands-on, a 10% off of our hands-on trainings if you come in, and you'll get access to all of the webinars that we do on a every other month type of a basis. And then our top one is called the Founders Club. That includes all of the digital libraries. You get 20% off our hands-on training, and you get to have this type of a call with us once a month. We do a live kind of a mentorship. Live Zoom call, and practitioners can bring in their questions that they haven't had people help them answer over the last month, and we look at it as kind of being mentors out there for practitioners that really are working by themselves or really don't have great mentors around them to really, really challenge them and help them grow in the industry. So that's kind of why we created the Founders Club out there.
Yeah, and what's really cool about the mentorship program is we have an entire community board where it's almost like Facebook for AI. And you can ask questions on there and get answers to your questions. If there's a problem where somebody doesn't have an answer to a question, our team will bring it to us so we can help answer the questions. So it's really kind of a nice, we want to be there for people who don't have a mentor. We want to be there to help you learn and grow and to be there as a support. So we can do it with our Zoom calls, and we can do it on the community board and answer questions. So it's Our mentees have loved it. We've heard great feedback. And what's kind of cool, how do we hear this feedback? Not only on our live Zoom calls, but when we have our meetings, when say like we go like the AmSpa or the Aesthetic Show, when we have these meetings, we will have a wine and cheese evening, and our Founders Club gets to come up and we get to hang out together and kind of get to know everybody even better. So it's fun.
All right. So I think that's enough for announcements.
Okay.
I think that's it for now until next month.
Okay.
But if you guys have missed out on any of this, jump on our website, jump on our Instagram, and you guys can see what other things that we're doing. We're trying to move and shake. It's a slow start for me. I'm like, oh, I really want to be on vacation again.
Right. Okay.
Right.
So we have there's something that the team has put together.
It's a recap video of 2022.
We haven't seen this yet. So there's a video that they're going to put up that's a recap of 2022.
Oh no.
It kind of makes me
be our bloopers.
That's I hope we have
Do
so
not
many
laugh.
Bloopers. Don't laugh. I don't even know what they did. So okay, guys,
I'm afraid to watch this.
We'll see.
Oh no.
Oh, that was cute. The Valentine's Day. All the questions they made us answer. There's Mint. That was Sunday I missed. The Aesthetic Show. That was a fun class. Oh, there's the Founders. That's our Founders meeting. I think we should ask very good questions. Dallas. Oh my gosh, how many people were watching that? I knocked over the whole thing. I can't believe you guys remember that. Oh my
that's
gosh.
awesome, guys.
That's funny. Of course, you get me knocking down the whole thing of Brad's boxes.
That's awesome. That's why we're doing little weight loss shots.
Right? That's semaglutide next. That's fun. Thanks, guys. That was
Thank
cute.
you, guys.
That was cute.
Wow. Okay. So now we're going to take our time and jump into tonight's topic. I think a lot of people have been asking about this because at the end of the day, I think it's starting to pick up trend, just like PRP started way back when. Exosomes is one of those interesting, cool things. I've been using exosomes probably for how long? Probably, when did I tear? I taught this when I was turning 40. So at
Years
least
ago.
I started doing my research in this regenerative game at least 7-8 years ago. And that's actually when I actually was using PRP 10
yeah,
12
and we
years
thought it
ago.
was more of a filler. Like we were using it, like we looked at the orthopedics and how they were using it, and we put in thinking, oh, they're going to grow this volume when it didn't happen. Yeah. So we learned pretty quickly that PRP wasn't a filler. But then through the years, we've learned so much about the entire pathophysiology of how exosomes and how PRP works. It's so very interesting. So tonight we want to kind of go into this. We know so much more now than we knew years ago.
For sure.
We're going to kind of go into this and delve a little bit deeper than probably you want to go, but it's good information.
Okay, so we're going to jump into this quickly and kind of recap a little bit of PRP, exosomes, and then really kind of delve into exosomes. And hopefully it will open up and then you guys can start asking some questions and stuff like that.
And we're reading your questions here, Faith. Thank you so much.
Guys,
but
can you go forward on the...
We're reading the questions here. So Annie, you're saying when is Hawaii, what did I say? June 17th, 18th in Honolulu,
16th,
and email the Aesthetic Immersion, learn@theaestheticimmersion.com to put your interest in.
Yep.
We're going to try to keep up with your comments here, you guys.
Okay, so What are biologics? Biologics is the general category of this, all of this stuff. PRP, exosomes. They're essentially a variety of like drugs that we create or products that are derived from human, animal, microorganisms using biotechnology. And so, all of it includes, vaccines, blood components, genetic stuff, tissues, recombinant proteins. All of it is all followed in. And what it's used to do is to create some kind of response in the body to control the actions of proteins, cellular expressions, things that activate or suppress whatever you're trying to do. But biologic essentially is a product or drug that we create out of a living organism. Okay. Next slide. Next slide. All right. So we jump into PRP because this is kind of the foundation of where a lot of this stuff started. And even to me, a lot of this PRP that's out there, I challenge it because I think that it's not talked about in the right way. Because when I learned about it, by definition, PRP is 6 to 8 times concentration, right? 6 to 8 times concentration.
Well, it should be.
Well, it should be. So you look at a lot of the things that people are doing out there, they're collecting 10 cc's, they're spinning it down, and they're collecting 5 cc's to inject into the vase. By definition, that's not PRP. That's just concentrated plasma, in a sense, because it's really 2 times concentration. You have 10, and now you spin it to 5. So 10 divided by 5 is 2. So really, when I started doing it, I started doing orthopedic ones, and this was 10, 12 years ago. We took 60 cc's out and spun it down, and I got 5 to 10 cc's out. That's true PRP, and that's what orthopedics are using in their aspects of it. And so when I'm looking at what we're doing in the aesthetic field, I'm not really believing that we really are doing platelet-rich plasma. We're doing platelet-concentrated plasma. a
little bit better than your own?
A little bit better than your own.
One step better than what you have?
Yeah, and so you guys really have to delve into what the science behind it is and what we're really, really talking about. And so this was PRP. And so we're going to jump from there. And so you guys can see what we're doing. Red blood cell, platelet-rich plasma, platelet-poor plasma. And you really, what I see a lot of people do is they tell you to invert it and spin it. Well, now you mix the platelet-rich plasma with the platelet-poor plasma, and you just get a little bit more of a concentrated plasma. Really what you should be doing is literally sticking the longer needle in, drawing it right at the bottom, right between that red blood cell, white blood cell layer, and then drawing that 1 cc, even half a cc. That's really your platelet-rich plasma. That's really the concentrated plasma that should be used.
It's usually right above that separator.
Yeah, exactly. But
there's usually a serum separator in that vial. So you've got the red blood cells, the serum separator, which is that little white plug, and then you've got that platelet-rich plasma right next to that. And
then we talk about it, right? And we talk about what PRP is. PRP, 8 different growth factors: platelet-derived vascular endothelial, epidermal growth, fibroblastic growth factor, insulin-like growth factors, transforming growth factor beta, and connective tissue growth factor, and keratinocyte growth factor. So these are the 8 growth factors that are documented in PRP. There are probably a lot of little other things that we don't know everything about, but this is what the majority of what we inject PRP and what we're using it for. Okay, collecting the blood, spin it down, and extract the PRP. Okay, that's PRP. Now, fast forward to exosomes.
Yeah, and why we're not using PRP.
well, the thing that PRP is, it's a flash of what you actually collect.
Right.
Right? It's kind of like taking your blood pressure one time out of a whole day, where if you're under stress, you're going to be a lot higher blood pressure versus a low stress. You're going to be more normal. So I catch you at that time where you have the most stress. I'm going to say, oh, you have high blood pressure. Platelet-rich plasma, at the end of the day, it's a snapshot of what you're really, if you're catching it. And first of all, if they're not healthy, you're not
you're gonna
getting
platelet crappy plasma.
plasma.
Yeah, what you draw is what you get.
Right.
So think about that. You don't have a lot of consistency
Nope.
in your patient. The patient is what you get.
Exactly.
So sometimes there's not a lot of
So,
consistency.
and that's one of the things that concerned me, because you get good results on certain patients, and then you may not get as good results on other patients. And so that's another key aspect of it with platelet-rich plasma. Yeah, it's cool that you're getting it from yourself, but the problem is how do you make consistency for a product that you are touting is going to give you a response when you yourself don't even know what's really in the product itself. It's the thought and the hope that it is. So fast forward to exosomes. So what are exosomes? Exosomes are pretty much nano-sized extracellular vesicles. They serve as meteors that do cell-to-cell communication. So the paracrine effect is what it is. And it's released by a lot of different cell types and found in all different types of body fluids as well as tissues. And we can use them for topical. We're using them for wellness. We're using them for IVs. We're using them injections. So there's a lot of usages for exosomes. So characterization.
We used it when we were sick last
Oh yeah,
year.
of course. We used it to protect our lungs last year.
Yeah. So let me.
A lot of more science with regards to what's in these exosomes. And people don't realize, and when I started doing research into this, exosomes were actually thought to be within the stem cells. They were thought to be the garbage vesicles.
Mm-hmm.
They were like, they fused with the cell membrane, they dumped it out, and it was just garbage that was being dumped out there. Well, lo and behold, what we're finding out is these exosomes, as you can see, the 30 to 100 nanometers, and probably they can range up to about 200 to 300 nanometers and be okay as far as really saying what the size of an exosome is. We're finding that the exosomes actually have a lot of cool stuff in them that are actually beneficial to the body in all aspects of it. And so this is why we're actually looking into exosomes. The whole thing was stem cells before, and now we're taking a step back and saying, okay, well, what is it about stem cells, and what is that whole mechanism that is making this regenerative thing work really, really well? And so
I kind of tell people, I kind of tell people that exosomes are, if you think of a stem cell as a car, think of exosomes as the engine. And we're really just taking that part out that really, really is active.
Yeah, I mean, if you think about it, exosomes are the messaging of a stem cell.
Yeah.
For lack of better terminology, they really are the messages. So inside of them are going to be lipids, proteins, genetic material. So there's mRNA in it. There is cytokines, interleukins, growth factors, a lot of different things that affect cell-to-cell communication within the stem cell world. And these are the messages, the exosomes are the messages that these stem cells release to the body and to the rest of the other stem cells and other cells to mobilize and do something.
Right. And so they are neutral. They're like little army ants that go out there, but they don't know where they're going. They don't really have a command, but they have a tendency to seek inflammation. They seek damage, and they just start repairing. So they kind of just go out there and they just start fixing and repairing and taking inflammation away, which is pretty amazing.
Yep, exactly. And so if you look at the exosome industry, what we're seeing is a significant amount of research now being done. As you can see, between 1990 to 2010, that amount of papers that came out was very, very little. Now, as we're going forward, between 2018 to 2019, over 1,000 new papers are starting to be published with regards to stem cells, and exosomes are out there. And so you're going to start seeing a lot more research with regards to this. Still going to be a lot of trouble with regards to FDA, and we'll talk a little bit about that. FDA approvals with regards to this. But you will definitely see lots of benefits. You're not going to see stem cells really disappear because they are a treatment for when you have leukemias, lymphomas, when they radiate all of the bone marrow, they need something to transplant into it. Stem cells is what they transplant into it. So it is a form of medicine that is already approved. It just comes down to the rest of us being able to use it in a different form, in a different part of medicine. And so that's where the rub is with the FDA. You can see lots of research: atopic dermatitis, biodistribution, skin barrier, skin regeneration. There's a lot of safety profiling. I know people are like, with stem cells, exosomes, is it going to cause cancers and stuff like that? There's one company I know in Taiwan that's actually done research now and shown that at least their product itself does not cause any cancer. They've grown it out, researched it out, and stuff like that. And they've had governmental backing from Taiwan for 15, 20 years on that aspect of it. So they have a lot of history behind that. So there's a lot of stuff in these. And you can see the exosome I guess you say conditioned media has a lot of growth factors. There's over 50 different growth factors that can be already identified, and there are probably a lot more that we don't have an understanding and can identify. You can see all the IGLs and all of those things, all the growth factors that are out there.
It's just I want you guys to think of this as like a complex that is just highly regenerative. You're looking at regenerating cells. You're looking at something that's signaling other cells to regenerate and to heal and to grow. And it's not something aberrant. It takes on whatever that cell needs. It's kind of like it takes on whatever coat that cell has, in a way. So,
exactly.
Yeah. So it's a very regenerative complex.
Topical wound care. There's a lot of research, and we're just going to fly through this.
This is amazing.
Wound care closures, reepithelialization of your skin. You can see how much more that you have compared to the negative. The exosomes do increase that. There's enough of a significance to show that you really do repair on a faster rate, and you repair into a deeper aspect of it, that you get better quality. Even in some of the papers that I've read, 600% increase in collagen production, 300% increase in elastin production just from using exosomes. You need to get it to where it needs to go, of course, but exosomes have the ability to stimulate the repair in to me, a more massive way than what PRP can do.
Yeah, we see. Do you use it after CO2s?
Of course.
Yeah, we
oh my God.
We're not in the same clinic. Sorry. It's amazing.
This is a paper. This is one of the first papers, the topical exosomes. 25 patients receiving 3 consecutive treatments of fractional CO2. Post-laser treatments were applied for each patient. One side was exosome, and the other side was a controlled gel. There was improvement of 35% or 32.5% versus 20% from the control side versus the side that used the exosome complex. And so the treatments related were milder. Post-treatment downtime was shorter on the side with the exosome. So definitely your patients are going to get so much more benefits and so much more less healing time from using an exosome serum when you are doing it with something that is traumatic to the skin. And there's a lot of inflammation. You decrease inflammation significantly and very quickly.
And in the opposition, adversely, PRP is very pro-inflammatory. So just kind of that PRP and people out there have done a lot of PRP, and people are swollen and stuff. But PRP is very pro-inflammatory, and exosomes are very de-inflammatory. So we find that there's a lot of decreased redness after treatments where we're doing something on the skin. To either burn it, to put holes in it, whatever we're doing, that we notice that the redness goes way faster, the healing's faster, and it's amazing.
Yeah, for sure. Anti-inflammation from exosomes. A lot of research. Exosome atopic dermatitis publication. You can see from mesenchymal stem cells, from human adipose, and from the fat, it helped to alleviate atopic dermatitis. Exosomes improved dryness, bleeding, suppression of immune cell reduction, improved thickness and improvement in dermatitis on these mice studies, reduced in IgE as well as immune cell count, and confirmed reduced in the inflammatory cytokine markers that are in there. So there are a lot of research out there that can support the usage of exosomes as well as stem cells in that aspect of it. And so this is where we're here to talk about it in a general sense, but this is still up to you guys to figure out where it fits in your practices. I mean, I've already been doing it naturally as an IV. Certain products, you definitely, I think in the industry, the hardest thing is figuring out who has good products on the marketplace. IV wise, you really have to do your research. You have to make sure that it's produced in ISO 7 laboratories and all of these type of things. And so stem cells, are harvested from different aspects of it. You can get them from adipose tissue. You can get it from bone marrow. You can get it from amniotic fluid. You can get it from umbilical cord blood. You can get it from Wharton's jelly. There's a lot of different types of origins of stem cells. That we're still learning as far as, is certain stem cells better in certain aspects of it? Do they each produce different type of cytokines, interleukins, all of that stuff? There is a difference among them, and we're still figuring that out. There's even like a company that we talk to that can take your stem cell from your hair follicle and actually re-engineer it back and literally grow your own stem cells from the little hair follicle stem cells that they collect. I think it was acorn. So we'll look out for that. So
you can keep it. So if you ever have a problem like with children later on, you've got your own stem cells that were harvested when you were healthy. So it's almost like umbilical cord from a baby.
Yep.
But they can take it from hair follicles.
Yeah.
Really cool.
I mean, that's the whole cool thing about exosomes, is you can use it. I know people have been talking about it for anything. We're getting lots of questions.
Yeah.
Anything that you would do PRP or PRF with, exosomes and stem cells are going to take it on steroids.
Yeah.
Period.
It's like PRP on crack.
I mean, hair restoration, I see O shots, P shots, way better. Faster kind of results with regards to that. So ultimately, there's a lot of different things. Exosomes for under eye treatment for dark circles. That one I actually find that PRP still is where I still go, but I do a combination of PRP mixed with exosomes to inject that.
So there was a question earlier about is it only topically? And
no.
Currently,
well, so when you talk about FDA guidance, FDA will not approve it for injection at this point in time.
Just topical.
The FDA will not approve it for topical, but there's FDA clearances for topical usages because that is a very separate branch of FDA. So there's FDA clearance for anything topical because you don't need to prove science with topical because you're not really claiming like a drug. If I give you blood pressure medication, it has to show that it correlates with actual blood pressure. There may be a mechanism of action that can be documented that causes your blood pressure to result in a certain way. And so that's where I think that the topical ones are going to be safer to use at this point in time for majority of you guys versus your exosomes that are more as far as the injectable route, the IV route. You just have to be careful. If you do it, just make sure that you sign the right consent forms, the right to try. Make sure that you're not claiming anything if you are doing injectable type of IV ones. That's where you're going to get in trouble with it. It's majority of the issues that people get in trouble with is that you're claiming something. When you're doing something topical, we're doing something topical, we see benefits, we see improvements in quality, decreased inflammation, all of that stuff. So it is very, very safe with regards to that. And what else? I could go on and on.
But I think as far as
FDA,
what they're saying is only topical. That's it, only topical. But PRP can be injected. So that is different. And that is okay to be injected to someone's own tissue, or own products. So like bottom line, are exosomes injected? Yeah, people inject them. Are they put into broken skin? Yeah, it heals them terrific. What does the FDA say? It says topical. So it's kind of
Well, the FDA will never say topical because FDA doesn't have any guidance when it comes to topical stuff. You have a clearance for topical.
right.
So that's all they have to go through. So anything topical out there is just through a clearance. They don't need they don't need to really go through anything except for the clearance on the aspect of it that there's no issues with regards to that. However, when it comes to an IV solution or something like that, that gets into a whole different realm. There are a lot of companies out there that are starting to do INDs, IRBs, and stuff like that. That's just going to take time and lots of money. And somehow some pharmaceutical company is going to have to let go and allow these natural things to actually be able to be used. That's where, it really, really is, for the future on the aspect of it.
I think that's coming though. I mean, I really do, because I think that there are a lot of histological studies going on. There's a lot of slides going on that you can really see the benefits and see tissue changes.
Oh yeah,
with and without exosomes. So it's coming.
There are research to show IV has improvements. The IV exosomes and stuff have improvements in MS, in ALS, anything inflammatory, lupus, blah blah blah. You name it, inflammatory. Boom boom boom. Off the mark, already improved. I've seen documentation in improvements in not necessarily ejection fraction, but actually cardiac tolerance. Their injection fractions still stay the same, but they're able to walk up and down the stairs, whereas they couldn't walk up and down the stairs. So after IV infusions with regards to that, kidney functions improving, liver functions, all of that stuff. COPD, huge benefits with regards to that.
People are coming off oxygen.
Yes, huge benefits with regards to that. And that's why there actually are a lot of INDs with regards to, and IRBs with regards to exosomes and post-COVID syndromes and stuff like that. So all of that type of stuff. IVs, unfortunately, I won't be able to talk about. That's something that that's a completely different thing. But as far as topical, for sure, my favorite one is Benev. And so I think if you reach out to our team here, they can give you a code. Benev has given us a code to let you guys, I think if you buy a certain 3 or 4 boxes, you'll get a discount. You'll get one for free or something
what was our
like
code?
that.
I remember our code.
I don't know. Can you guys get us the code from Brian for the exosomes? Thanks.
So we can give you a discount or code.
But yes, it is the ERC. The exosome regenerative complex that they have is great. They have a 2.5 billion. They have a 5 billion.
Just get the 5.
Get the 5. Don't even worry about the 2.5. When they come out with their 10, which I hear they will be coming out with their 10 billion, I would stick with the 10 billion. You can only need more. There are, think of exosomes as little fire people putting out fires. Your body's in fire all the time, just from living. You have little fires everywhere. There's inflammation going on everywhere in the body. However, certain parts of the body are going to be more inflamed than other parts of the body. And so they're going to call out, their SOS signal is going to be calling out so much more, so much faster, that when you inject or get exosomes into the area, your body's going to go and whoop, it's going to absorb and decrease the inflammation into those areas. So exosomes is can you drink exosomes? Trust me.
No, I want to drink and take a bath in it.
I've already been injecting exosome on myself for and this is even the one that I use. For just going back when I actually started, I actually did the one where I actually sucked out fat.
Yeah.
Spun it down. You remember that. Spun it down, collagenased it, collected my own stem cells and exosomes, and then re-injected it. And I actually experienced it because I actually tore my bicep when I turned 40. I tore my bicep off the bone. And so when I was supposed to go through physical therapy, I literally, right after surgery, 1 week later, I got my stem cell infusion done. And ultimately, what was supposed to be a healing time of 6 to 12 months turned into a 3-month healing process. I literally was back into lifting weights within about 3 months. Probably about 4 or 5 months, I was already back to kind of almost normalcy.
You're the bestest.
Well, these are the things. We know that we're gonna age, and so I'm gonna do everything I can to slow down this aging process as much as I can. I think I've gotten the face down a little bit, at least some control on that aspect of aging, but the inside, yeah, we don't realize how much that ages. And
Well,
if this is an internalization or an externalization of what's going internal, we need to make sure that we're cleaning up the internal.
So speaking of internal, this is not a plug, but you can always contact me, DM me if you want. But I have been taking this stuff called Time Plus, and it is something that actually boosts your NAD way more than
NAD.
way more than NMN. So there's a company that's in the UK that I get it from, and you can DM me if you're interested. But these will actually boost your NAD, which helps cellular communication, which is very, very anti-aging. It's awesome. So anyway, it's the bomb. So DM me, Injection Expert, if you have a question. Yeah. Somebody, there was another question here I was going to answer. How do we apply exosomes? Do we wait? So I put exosomes on directly after I do any treatment. If I'm doing microneedling, CO2, whatever it is, anything
RF, anything that you're creating holes.
Yes, and you were asking, how do I sell it to a patient? How do we tell the patients about this?
Like you did PRP.
I tell them that this is I'm like aerating the lawn, okay? And this is fertilizer I'm throwing into the aerated lawn. It is, I can either aerate the lawn and the grass grows better, or I can fertilize it and it grows like heck. So patients understand that when you kind of use an analogy of like, you know what, it's just fertilizer I'm throwing on there, and with those little holes, it's gonna get in there. As long as you don't have a bloody face, don't do the microneedling where they're bleeding, because you can't get anything in the holes if they're bleeding. So back off on the depth you're going. But these are amazing, and it throws fertilizer and it helps with all that stimulation of new cells.
My face. All from the exosome, microneedling exosome. Yeah. I do a laser follow up with microneedling exosome, and that's all I do. I don't even use skincare very much anymore. I never really did.
So for your buy package or discount for the Benev exosomes, it's AI, capital A, small I,
Aesthetic Immersion,
dash
AI,
XO, capital E,
X,
capital X, capital O. Nope, hold on. A, capital I,
A, capital I,
A, capital I, dash capital EXO, all capitals. So AI dash XO. And then you buy 6 boxes, you get one free, which is kind of cool.
Yeah, I mean, ultimately,
this is turning into an infomercial. That's not what we wanted.
But the reason why we like Benev's one is people do not realize this, but getting exosome on the back of the packaging as an actual ingredient is very difficult. That means they've gone through the whole world scheme of actually ingredient list and actually shown them that the processing is up to a certain standard, that they actually have done their research on the positives, the negatives, the adverse events, and now they've approved by the international standards of cosmetic ingredients that they are an actual ingredient. If you look at any other ones out there, what is it? The other one, Plated is one. There are a lot of other exosome serums that are out there and stuff like that. And you look at them, they will say it's some kind of proprietary complex, or it was red blood. It's red blood
cell
or platelet components or something like that. The Benev one, if you read the back and really read the ingredients, it actually says exosome complex. Yeah. And that one, to me, tells me they've done their research. They did it. I went to Korea, and I got to tour the facility that they have. It's a new 22 to $25 million facility. They produce it in an ISO 7 laboratory and stuff like that, which is essentially the grade you would need to actually inject it if you wanted to inject it. Not that I would tell you to inject it whatsoever, because this is made for topical only. I do go with other companies for injecting on the aspect of it, but they make it super easy. They come with a box with 2 little bottles in there. One is a powdered form that is all the exosomes. It's lyophilized, so it is lyophilized, which means that they've stabilized it. As long as it stays in the refrigerator, it's good and works for you. And then they have a serum that is a whole condition medium serum with all these different extra growth factors. What you do is you mix it together, and then you rub it on topically after microneedling, after CO2 lasers, after microneedling RF, whatever you do, you just rub it in. I actually tell my patients to go home and leave it on for the rest of the night. I don't even tell them to wash their face until the next morning, because when you wash it off, you actually feel as though there's this nice film that comes off. It literally you want it to stay there so it absorbs. You can use any way you want to get the exosomes into the tissue. Do I inject it into the hair? Yes, I do inject this one, but that's off-label. That's not something the company tells you, but I do take it and inject it. Your choice. I've done the combination where I've taken the serum and injected it into the hair, the whole combination. Or what I've done is just taken the exosome serum and added saline into that, or you can add PRP or whatever you want, and then you can inject into that. It all comes refrigerated. They pack it into, with the ice packs. You just need to store it in the refrigerator on that aspect of it. So ultimately, this can be done after pretty much anything. I mean, I've done it on patients' burns. So part of my burn protocol, if I get patients for laser hair removal burns, they'll come in the next day. We slather on the exosome serums. They take the rest home, and they're changing it and slathering it on. And going from there. I think the cost of it, I'm not sure of it with regards to the deal that you're going to get, but typically we'll run you about $150 probably if you're getting the 5 billion serum. The 5 billion, I think 150-ish, maybe it's a little bit more. Don't quote me on it. But, I mean, if you think about it, it's the same price as what you cost your PRP, but you literally go to the refrigerator, grab it, open it, mix it, and you go. You don't have to do any drawing of blood, whatever at all in that sense. So,
and then if you use a curicator to put on, it makes it even easier.
Yes.
That little device is awesome.
As far as what you want to do, you can do however much you want. Half a bottle, full bottle. I use a full bottle.
I do too.
I don't even want to save it. I want the patients to get the best benefit. Sometimes if there's a little left over, I'll give them the syringe and I'll say, go home tonight, wash your face, and then put on over your whole bottle, your whole face. Thank you, Dominic, on that. Breaks it right down.
Dominic
Beautiful.
Totally did your research.
So
Thank you.
ultimately, the more boxes you buy, the better pricing you're going to get. And then if you use the code AI-Expo, you'll get one extra free box if you buy 6 boxes. It really is so...
It sells itself.
It sells itself. You don't need to worry about that. Yes, if you wanted to use it for O-shot, P-shot, go for it. Anything that I would have done PRP, PRF for, I don't even bother with it. The only one thing that I do like PRP, PRF still for is the under eye, that panda eye, that hue that you can't seem to get rid of. I still think that PRP does something. I have yet to really just try it alone on exosome. I just was like, PRP did so well with it. I actually do PRP with the exosome, mix it together and inject it together.
Do with carboxy.
Yeah, exactly. Yes, everything is off label if you're injecting it. How long will exosomes last once it's open?
They have to be refrigerated.
You still need a refrigerator. There's no opening because it's already a powder form. So until you mix it, I think once you've mixed it, you probably want to use it for a few, within a day or 2 days, you really want to use it all. And, it's going to depend on you, but there's 2.5 billion and 5 billion. I will definitely tell you, I've done the 2.5 with microneedling. I've done the 5 with microneedling. I found that literally my microneedling, I have no issues with it. 5 billion, I'm good. You literally can't even tell that I did it. Microneedling RF, by the next morning, nothing. The redness subsides so quickly. It really, really decreases inflammation like that. I mean, I've never seen anything do anything that powerful. And I would definitely say if you look into the hair regenerative world, your world-class hair restoration guys are all starting off with exosomes and stem cells as their first initial thing. You can follow up with PRP if you want, or you can just continue with exosomes. That's going to be up to you. But remember, the loss of follicles a lot of times is the body attacking itself. and there's inflammation going on, which constrains the blood flow into the area. So you put something inflammation into the area, you're going to get the blood flow back into the area and allow the area to actually start to repair and heal itself.
And can you use it in a device like Aqua Gold?
Yeah, for sure. I mean, you can totally do that. Just make sure you use it all, because you're going to waste it if it's just sitting there, or give the serum to the patient so they can rub it on afterwards, is what I would definitely do. So
good questions, you guys. Thank you. Great questions on these.
But yeah, I mean, you can mix these with whatever you want. I mean, if you want, if you want to mix them with, PRP, PRF, you want to mix it in whatever concoctions you have, I think it's fine. The exosomes that they have are lyophilized. So the exosomes itself is the powdered form, because they've lyophilized it, and that's where you use that portion of it. They have the serum portion, which is more growth factors and stuff like that, which they're known, and the HAs and stuff like that, and put into the area, and you can mix and match them. In aesthetics, can these generate collagen? So they will help to, create more fibroblastic activities, which create collagen. So yes, for sure. Clients always ask the source of exosome. What is the most common? Everybody will get exosomes from differently.
Yeah.
Benev gets them from fat. Majority of people get it from fat, because there's a lot of stem cells within fat. But ultimately, it is safe, because exosomes are not a cell. Remember, it's a cell product, so it's inside. So it's like having the furniture inside your house move to a different house. It's not tagged as this belongs in this house. That's the reason why a lot of people are afraid of stem cells, is because they have the HLA antigens on it and stuff like that. So ultimately, we're not going to inject someone else's cells into me, because I'm going to get an antibody response to it. Exosomes have nothing to do with it. They're interleukins, they're mRNAs, there are cytokines. They have no HLA factor to them, because they are the messages inside. Okay, so you have to delineate that these are not stem cells. If you're going to inject stem cells, whole nother story. Umbilical stem cells is probably your best bet, or you do autologous type of stem cells and stuff like that.
Question. We rolled by it, but can we microneedle it into the? Oh, Randy, can we microneedle it into the skin?
Yeah, of course.
Absolutely. Use it as your glide.
Yep.
It's the best.
Yep. Just don't get it so bloody, because if blood is coming out of your holes, you're wasting product. It's just coming all out. So all of you guys that are doing PRP and getting your patients all bloodied out, you guys are wasting PRP too.
Yeah.
Just FYI, think about it. If blood's coming out of the holes, what do you think is going in? Nothing. Okay, you guys have to really think about it. Don't let trends and Instagram influence you. Go back and research it. Think of things naturally on your own. And so with that, they are closing us down.
I know they're telling us to be quiet, but wow, we could go on all night. You guys thank you so much. You had great questions.
Join in on the exosome. I think Dr. McCoy and Dr. Jin. Dr. Jin's a PhD. He's been studying the exosomes and regenerative stuff for a while. So the Benev exosome talk, I think, is going to be somewhere in February. So go on the website.
16th,
the 16th.
I think.
So you can get onto that and join them. It's free, and you can learn more about the exosomes that Benev does produce. And if you are looking to buy them, go on Benev's website, type in AI-EXO, and you'll get that extra free box if you order 6 boxes of exosome. It goes fast. It's such an easy upsell. And honestly, because you're not doing anything, I'm not drawing blood, I'm not doing anything. I mean, you could literally do it for everybody. Yeah. I mean, you could do a facial, like a microneedling, and just a microdermabrasion and slap some exosomes onto them. Exosomes are so easy, and for burns, wonderful. You're going to heal up so much faster, less scarring, all of that stuff. So I could go on and on about it.
DM me. Somebody asked something about the anti-aging NAD producing pills. So DM me if you want. It's called Time Plus, but DM me. But it's something that I know. DM me about that. DM him about everything else. But yeah, it helps us really boost our NAD by about 235%. So it's pretty good stuff.
So if you have any other questions, DM us at the Aesthetic Immersion, or www.theaesthetic immersion. Look us up on our website. Our email is learn@theaestheticimmersion.com if you need to. Look out for upcoming webinars with Benev, February 9th, February 16th, February 23rd. You can go on to, I'm sure, our site and look out for that. There will be a replay of AI Live on our YouTube channel. So subscribe to the AI Live YouTube channel and watch all the rest of them. And what else?
Our next AI Live is going to be February 7th, and it's
Yes.
going to be on weight loss. So we're going to be talking about the GLP-1 inhibitors, which is the semaglutide, Ozempic, and Wegovy. So this is what's been so big lately. So we are going to talk about how it works and everything about that.
Cool. Sounds good. Other than that,
we're good.
Happy New Year, guys.
Happy New Year.
I'm wishing you guys a amazing, prosperous, healthy, fun-filled, educational year. And if you remember, don't forget about Hawaii. I think there were a bunch of you guys that wanted to. So email at learn@theaestheticimmersion.com and let them know that you are interested for that. Other than that, we'll see you at the next AI Live.
We'll see you next month. Thanks
Bye,
for
guys.
watching.